Hello and thanks for tuning in. In this module, we're going to review the implementation elements for the patient's medical home. In Alberta, the concept of patient's medical home came to us from the College of Family Physicians of Canada, which provided us with the vision for PMH, the pillars that medical homes are built on. These pillars provided the what, but we needed to know how a family practice clinic could transform into a patient's medical home. Primary care networks in the province are supporting family practice clinics in this transition. What you see on the screen are the 8 implementation elements of the patient's medical home that Alberta adapted from the Safety Net Medical Home Initiative. This was a 5-year demonstration project with the goal of developing and demonstrating a replicable and sustainable implementation model for medical home transformation. This model is evidence-based and has become our roadmap. We'll go into each of the elements in more detail. One of the foundational elements of the patient's medical home is having engaged leadership. As PMH transformation work requires changes in things like culture, relationships, and routines, engaged leaders are required to set the course, clear the way, and support and sustain efforts. So without the support of physician leaders, office managers, and others in the clinic, it would be difficult to make the changes required to support PMH transformation. Another foundational element is having the capacity for improvement. This means having a healthcare transformation workforce, roles like improvement facilitators and physician champions who support change and quality improvement work. It also means having a quality improvement strategy to help clinic teams with confidence, skills, and a specific organized approach to making changes. Panel and continuity provide a critical foundation for all other work required for PMH transformation. In the most basic definitions, panel is the group of patients who consider a physician to be their primary care provider and that physician agrees. Continuity occurs when care is provided by a patient's own physician or care team whenever possible. This is important because when clinics know precisely whose care they're responsible for, they can provide care proactively versus reactively and make sure that their patients are offered appointments with their own physician or care team whenever possible. This is important because continuity of care results in significant health benefits for patients, longer, healthier lives, and also benefits the healthcare system by reducing utilization and hospitalization and overall costs in general. The continuity posters you see here were developed with recommendations made in the Imagine Citizens report with input from more than 1,800 patients and partners at Alberta Health Services, and the Alberta Medical Association. They speak to the importance of having conversations with patients about continuity. Try to see us first, for example. On the slide, there are 2 examples, but there are several to choose from on our website. These posters can be customized with the addition of a PCN logo. Physicians alone don't have the time to provide all necessary care services to a full patient panel, especially if they need to provide access for patients to have good continuity. So, in a patient's medical home, care is provided by a team led by the physician. High-functioning care teams have been shown to improve practice efficiency, quality of care, and overall satisfaction for both patients and providers. But clinic teams don't become high-functioning without actively working on things like communication and coordination. PMH teams practice organized evidence-based care. This means that they are very deliberate in planning care according to each patient's needs by doing things like identifying patients at risk and ensuring they're receiving optimal care and follow-up. PMH teams also use point-of-care reminders based on clinical practice guidelines and have up-to-date information available so that providers and care team members can provide proactive care. For example, being reminded by the EMR that a patient is due for things like screening or prescription refills so that they can be addressed during the current visit, even if that isn't what the patient came in for. Patient-centered interactions encourage patients, and family members in some cases, to be part of their own care team. Patients are encouraged to play a strong role in making decisions about their health, and any communication with patients involves language that they understand. Patient-centered clinics respect patients' values and preferences. Instead of asking, "What's the matter with you?" they ask, "What matters to you?" PMH clinics also regularly ask their patients for feedback on how they can make the experience at the clinic even better. Given how important it is to have continuity of care with a physician and team, access to care is something all medical homes monitor and continually try to improve. They work to ensure that patients can be seen by their own physician or care team when they need to be seen. The goal of care coordination is to make the family practice the center of care for the patient. Care must be coordinated not only within the medical home, but also between the medical home and the health neighborhood and broader healthcare system. As an example, if a patient ends up in the ER or hospital, the medical home is contacted so that they can reach out to the patient to follow up and support their care after discharge. Also, when referrals are made, communication occurs between providers so that the patient doesn't have sole responsibility to remember the details of their history, diagnosis, or care plan. Finally, patients' medical homes don't think of quality improvement work as projects. Being a medical home and focusing on quality improvement is just part of their culture, and they sustain the improvement by continuously checking to make sure they haven't started to slide. It's just how they do things. So that concludes our primer on the PMH implementation elements. For more information, check out the website listed on the screen, and thanks for watching.